Hello everyone, this is Dr. Sneha Shetty, role of hysteroscopy in unexplained infertility. So unexplained infertility is quite a frustrating diagnosis which is given by doctors to couples. In this cases, the basic three tests, that means the female partner is ovulating properly, both fallopian tubes are open, and also the male partner semen analysis test has come out to be normal. Still, they are not able to get pregnant, either naturally or even sometimes via basic fertility treatment like IUI. Such couples, we usually categorize them as couples who are facing unexplained infertility. Today, let's discuss whether hysteroscopy has any role to play in these cases of unexplained infertility. So firstly, what is hysteroscopy? Now, hysteroscopy is a minimally invasive procedure which is done under anesthesia by a fertility specialist who inserts a hysteroscope, which is a thin, small tube which has a light source at the end and also a camera which is attached to the TV unit or to a monitor. This hysteroscope is inserted into the uterus through the vagina and cervix, and the uterine cavity is checked for any kinds of uterine infection or any polyps or any growths like fibroids, etc. So this helps us not only to diagnose if there is any uterine problem, but also helps us treat that problem then and there. Now, what is the role of using this hysteroscopy in unexplained infertility couples? Unexplained infertility couples, this hysteroscopy can help us as it is a very important diagnostic tool to help us understand whether there are any conditions like adhesions inside or polyps, pimple-like growth-like structures, or any fibroids which are present inside the uterus, which might have been missed during the routine screening or the routine ultrasonography procedures. Or if detected, this hysteroscopy also helps in treating them. Now, certain cases also have certain congenital abnormalities in the shape of the uterus, like having a septum or a abnormal growth inside the uterus which can be corrected, or certain conditions wherein a congenital abnormality in the shape of the uterus wherein two uteruses are present, or only one uterus which is bent to one side, which we call as unicornuate uterus, etc. These conditions help us identify the cause for unexplained infertility and also helps us understand the further management which can be done for them. Now, does this hysteroscope improve the pregnancy outcomes? Now, like we discussed, it is a see there and treat then and there procedure, wherein we identify the problem, and if there is a problem, we immediately treat it. But sometimes if everything is fine, it definitely does give a very reassuring feeling for the couples, reducing their stress, thereby increasing the chances of conception. But do all couples with unexplained infertility require hysteroscopy? This is absolutely depending on the couple's history per se. So it has to be a very personalized approach. Discuss with your fertility specialist whether your condition requires a hysteroscopic evaluation or not.